therefore, both nationally and locally, we were trying to find our way through the response. And that was certainly the case with protective personal equipment, or PPE. In the early days of the pandemic, we were at crisis levels with regard to a shortage of PPE and the NHS. And that meant that a lot of the supplies that were due to come to Redbridge were actually commandeered by the NHS. And therefore, we are running with a very small stock locally as well. However, quite early in the pandemic, we were able to establish a store of PPE, which generally we've had a good supply line into. So we've never actually run out of PPE through the pandemic, and our stocks are currently good. And we've been issuing that PPE to social care providers and other organisations on an emergency basis. So our message has been continue to seek to source PPE from your normal routes of supply, but we do have a stock should you run out. And actually the use of our store has reduced over time, but we were making large numbers of deliveries in the early days of the pandemic. Another headline issue that we faced was the whole issue of testing for the virus, and I think it is fair to say that national arrangements were confused. Multiple pathways for different organisations were being established for testing, most of which ended up directing people to the drive-in facility at the O2. Since then, things have got better, and you'll be aware that we've had the mobile unit based at Gants Hill, and the news today that we are going to have a permanent unit in the Mildmay car park, which we are absolutely delighted with. And also the testing of care homes has started, so staff are now being tested on a weekly basis and residents on a monthly basis. So again, it feels like the testing position has got much more stable, and the number of tests available, again, was an issue at the beginning with regard to national capacity to undertake tests, but that has improved significantly subsequently. And generally, we're seeing a reasonable turnaround in tests. Still some issues, though, around how tests are being administered. Test and trace. Obviously, test and trace is a key part of the preparations for a second phase of the pandemic. Elements of the national system went live on the 28th of May, and as a council, our local role is really focusing on those situations which are considered to be complex. So should we, for example, experience an outbreak in a school, a care home, or a more localised outbreak in a specific community, then actually that's when essentially the council steps in. But in the meantime, those national arrangements for identifying and following up contacts are in play. Now, when I wrote this presentation, I somewhat optimistically said that the app might be up and running before the end of June. Clearly, that hasn't happened, and I think we're now looking at September at the earliest, if indeed we actually see a contact tracing app anyway. But as I say, we have a lot of experience already in testing and tracing for different diseases, and using that experience locally has left us well placed. So a bit about how as services we have responded. So in the early days of the pandemic, there was an absolute focus on our support for acute hospitals, a real concern that acute hospitals would fill very quickly and be subject to demand that essentially was unmanageable. That didn't come to pass. Activity in hospitals was lower than was expected or modelled. But anyway, we implemented new discharge pathways for people, which essentially involved putting in place new arrangements that would get people out of hospital quicker. And we moved to a discharge to assess model, which saw care assessments happening in people's home and outside of the hospital ward. They were things that we'd talked about for a couple of years, and then ended up implementing in a couple of weeks. We put in place traditional temporary additional community provision to avoid delays in discharges. So as you might be aware, that for a period of time we took over the Newbury Park Hotel as a care facility, and which was subsequently stood down because the demand didn't materialise to the extent that it was thought it would do at the start of the pandemic. And obviously, we have primary and community health services managing higher levels of need in the community for people who might otherwise have gone into an acute setting. And I'll say a bit more about future arrangements later on that. There's rightly been a considerable profile attached to the support given to care providers through the pandemic. So generally, we have sought to maintain contact with local providers in Redbridge, with daily calls to them to check that they are okay and they have what they need. A lot of advice and guidance has been provided by public health colleagues to our care homes in regard to both general management of infection, but specifically where homes have experienced local outbreaks. We recognise the additional costs of COVID by providing a temporary funding uplift of 10% to providers, and we put different payment arrangements in place to protect their cash flow. And as I said, we made available access to PPE. And since then, the government has made available the Infection Control Fund, which is currently being distributed to the providers themselves. We did a lot of work to seek to support local communities. We had about 8,000 people shielding in the borough, and I think we're up to about 20,000 people who we felt needed to be contacted because of concerns around COVID. So we established the Wellbeing Service again early on in the pandemic to provide that local support to people who wanted to call us for advice and guidance, but also to make proactive calls to people. And that has been very successful. And that Wellbeing Service also organised drops of food and supplies to people who were unable to source their own, but with a real focus on equipping people to be able to source their own supplies. We quite deliberately did not want to become a sort of permanent food delivery service during the pandemic. As we know, the national shielding arrangements are ending on the 31st of July, and we are currently reviewing the local arrangements beyond that, and I'll say a bit more about that shortly. And of course, we placed quite extensive advice and guidance to households on the council's website, and that has been grown during the course of the pandemic. Just a bit more about supporting care homes. As I said, we have been looking to provide advice and guidance with a multidisciplinary team approach from public health and our GP and other health colleagues. The guidance has been changing on a regular basis, so we've had to ensure that the care homes are as up to speed as they can be. We have had outbreaks of COVID in Redbridge care homes, so again, we've been supporting them to manage that. The CCG has increased its infection control capacity, which has been very helpful to supporting care homes locally. And as I said, the Infection Control Fund funding is being distributed. We are working with the CCG in order to put arrangements in place that would end the placements of COVID positive patients in care homes, even where care homes can isolate. And I was discussing that with the CCG today. I think what is likely, we will probably end up securing some specific capacity which can be kept remote, within a care home for people who are COVID positive on discharge. But having said that, the numbers are very low at the moment, so we want some specialised capacity in the borough for that purpose. Just a bit about our response to supporting and safeguarding vulnerable adults. The adult social care and community health teams, integrated teams, rapidly restructured themselves from 4 to 2 locality teams to provide better capacity and resilience through the period of the pandemic. And resources were moved into the hospital discharge team to facilitate hospital discharge, and to the first contact service, which is essentially the front door for social care. The vast majority of services in adult services were maintained. Obviously, we had to stand down day services, although we did keep a very reduced day service available with social distancing in place for those people who we consider to be the most vulnerable. And we used some of the capacity that was freed up from day services to provide more support to carers, daily phone calls to carers, for example, just to check that everything was okay. Generally, we've sought to move to a virtual approach through the work that we do in assessments, but retaining face-to-face contact where we think it might be necessary, particularly in safeguarding cases. And we have increased our work across North East London with our neighbouring local authorities. And overall activity has been at normal levels. So safeguarding activity in adults has been what we would normally expect. We haven't seen a reduction. And because we were not particularly affected by COVID from a staffing perspective, we didn't utilise the easements, as they were called, that government made available to us with regard to the Care Act. Essentially, there was some loosening of the Care Act, and authorities had the option of applying to the Secretary of State to use those easements. In Redbridge, we didn't feel the need to do that. On safeguarding children, the response has been similar to that to adults, with services maintained throughout the pandemic period, moving to a virtual service by default, but again, face-to-face work happening where there has been concern around the child. Overall, the level of contacts during the pandemic period is down about 25%. Initially, it was down by about 40%. As of last week, it's virtually back to normal levels. So that is causing a little bit of concern because, of course, many children are not back in school. So we are expecting to see a significant increase in September. Performance in respect of the timeliness of visits and interventions has been strong throughout the pandemic period and has been maintained. And we also did some targeted work to engage those older young people who we spotted just out and about, generally in groups, things such as sexual exploitation, criminal exploitation. They have not disappeared during the pandemic. So the social workers were, as I say, out and about, engaging with the young people, talking to them and speaking to them about options for their own safety. We established the reach out service, which recognised the likelihood of an increase in domestic violence within the borough. So that's a dedicated service run out of our multi-agency safeguarding hub that provides a focused intervention for people who are reporting domestic violence. It's a much more immediate response than perhaps we have done traditionally, and we've put a real focus on working with perpetrators. So we've had 300 referrals to the reach out service. Those 300 referrals represent 500 children, and we've had 83 referrals of perpetrators of domestic violence. And of those 83, 61 have engaged in programs of work with the team, which actually, I have to admit, I was surprised how high that is. So we're absolutely delighted that we've been able to secure that level of engagement. And additionally, the Redbridge Safeguarding Children's Partnership, both the Children's and actually the Redbridge Safeguarding Adults Partnership, has maintained a multi-agency safeguarding risk log. So we've been talking to the police, we've been talking to health and other partners around the risks to safeguarding through the pandemic period and monitoring those risks on a regular basis. Support to schools. So this is what we've done, and I'll move on to what we will be doing. Just to emphasise, schools have been open for virtually all the pandemic, and that includes all schools in Redbridge. So they've been open for the children of key workers and vulnerable children. And then obviously we had the phased opening of the year groups from the 1st of June for years R1, 6, 10 and 12. Fair to say that attendance has been quite low, particularly for vulnerable children, although it has been increasing, and I think we're now up to about 26%. Lots of logistical activities have been undertaken with regard to ensuring that children can still access a free school meal where they're entitled to it, and also to distribute laptops to children because of the national and local concern around essentially children not being able to engage in online learning, particularly those children in more deprived circumstances. Our SEND services have been maintained, but clearly there has been an issue with some children who haven't been able to access the full support that's specified in their EHCP plans, but we have sought to risk assess each of those plans to ensure that we're doing whatever we can to ensure that those children and young people get the provision that is in their plans, but recognising in some instances that just is not possible. So just looking forward, clearly we are continuing to think hard about a second wave and the risk of future outbreaks. A local outbreak plan has been produced, and the link is there if anybody wishes to read that. As I said before, the test and trace arrangements are now in place, but I suspect they will develop further. And we are doing some targeted work to reduce the risk and impact of COVID for Black, Asian and minority ethnic communities, which Councillor Santos will say more about. Our pandemic management arrangements will stay in place, and I think they will continue to be in place for a long time yet. And as I said previously, the wellbeing service is being reduced with the reduction in with the changes in shielding, but we are going to maintain that wellbeing service, so it will be focused on receiving calls, and then obviously if there is a significant second wave, we will stand it back up again in order to move to take outgoing calls should we need to do so. The recovery of services, as I said, because actually the vast majority of services within the Directorate have not been stood down, we do not have a major piece of work to do in order to stand those services back up again. The services have developed a plan for the gradual reopening of day services, just recognising the stress and strains that are very real for a number of families at the moment, and then I've realised I've forgotten to mention all the work that we've done to support carers during the pandemic, and also thinking hard around how external services such as respite are going to be accessed post the opening of those services, because there will be a high demand for them. We are actively involved with the health service with regard to managing the recovery of NHS services, because quite clearly there is a knock-on impact on local authority services from those changes within the NHS. And as a range of services, we will be maintaining many of the working arrangements that we have had during the pandemic. So we suspect that we will continue to have virtual working, to us probably permanently now, and we will be thinking about how we use physical accommodation quite differently now that actually we've tested the capacity to work remotely. And then obviously, if you've seen the budgetary control report, the financial recovery of the organisation is an absolute key priority. And it's certainly a key priority of the People Directorate over the next couple of months to support and develop our plans for financial recovery. Schools, all schools will be open for all pupils from September. The government has made that very clear. So Colin and his team are producing a lot of support and guidance for schools on the curriculum and the practical measures that schools need to take to reduce the risk to children and staff, building on the experiences from the 1st of June. And I think we absolutely recognise that children and young people have missed, many of them missed a significant part of their education over the last 4 months. But quite clearly, this cannot just be a case of expecting them to catch up with that missed content in a very short period of time. Actually, children and young people, they need help to be able to learn. They need to be supported to return to essentially the approaches, the skills, the aptitudes for learning that they had pre-pandemic. That just isn't going to suddenly materialise. So a lot of focus is on actually supporting pupils to be ready to learn. And similarly, a lot of young children and young people, they are going to need the opportunity to talk about their experiences of COVID when they get back to school. So those things need to be thought about and factored in as those children return to school. Having said what I said before about catching up on the lost curriculum, obviously schools have received catch-up funding from the government, which is in place for the next year to support tuition and other support for learning. But again, we would absolutely emphasise the need for those children to be supported to rediscover their approaches to learning to ensure that money is used to best effect. One of the issues from COVID that has sort of crept up on us is that as part of the funding arrangements for TfL, the government has asked TfL to withdraw the free transport offer for children. That has a potentially significant impact on home to school travel. As a London borough, we've not really had to have much regard to mainstream home to school transport. The withdrawal of the TfL transport means that actually that's going to create some problems for children and young people who are potentially travelling quite long distances across the borough, and indeed potentially create problems for children and young people and families who are living in poverty. So we're very aware of that as an issue, and there is a lot of discussion happening at a London level around actually is it feasible for that change to be made in September, and to start to work through the implications of that change for whenever it is to be implemented. Future demand, I've mentioned briefly. We are planning and preparing for future demand increases. As I said, we expect to see quite significant increases in contacts to children's social care as children return to school, and safeguarding concerns are more easily identified. If we're at the normal level now, and as I said, lots of children are not in school, then we might expect quite a significant increase in September. Talking to the police the other day, and we're seeing it as well with regard to the domestic violence cases that are coming through, it does feel as if actually we have missed, say, 14 weeks of potential intervention. So things are generally reaching us at a higher level of need than it might have done normally. Similarly, we are expecting demand increase in adult social care as health services are restored, and, for example, more people go to their GP, and it becomes more evident there is greater contact between family members, and it is noticed that some people are finding it harder and harder to manage independently. We do have concerns around mental health. Resident surveys of adults and a survey the Youth Council have undertaken of children have all pointed to people being more concerned around their mental health during the lockdown period. And as I said, we also have got concerns around the demands that the pandemic has placed on carers. We've sought to provide advice and support to those carers, but quite clearly many of the services they were able to access pre-pandemic have not been there. So our carers in the borough have been, really, it's been quite a relentless period, I think, for many of our carers. And then lastly, we are still learning about this virus and the long-term impact of the virus. So what we are seeing is that people are coming out of hospital, particularly for those that have been in ITU with COVID. They have long-term care needs. They need a longer-term reablement process. So we're looking at extending our reablement care services, and their care needs are more significant than we had originally anticipated. And then lastly, just some reflections to me. I'm incredibly proud of how the Directorate has responded. Staff have been incredible in the hard work and the commitment that they have put in. It really has played to a lot of the values. This is why they essentially chose the profession they chose, and they have been absolutely determined to provide support to the vulnerable and relative residents more generally through this period. Equally, I am very conscious we've got an awful lot of stored up annual leave, and we do need to ensure that they are taking a rest. As I said, the pandemic is not going to go away, and therefore we've got to ensure that our staff are able to just have a bit of downtime as well. We have learned that actually we can do things very quickly. The wellbeing service was set up in less than a week. So there's some reflection we're having there around actually our traditional approach to project management and what learning we can take from pandemic period. And also we're learning quite a lot from the wellbeing service, and indeed the approach that colleagues in children's services have taken to that very frequent wellbeing check. It's not statutory, it's not required, it's not a big thing, but actually it's producing really successful results just by checking in on people that they're okay. As I said, I think we had good and strong multi-agency working across the BHR system, and thank goodness for that. And I think the integrated arrangements with NELF in adults have really given us a strong position in order to respond to this pandemic. We've had a really strong foundation to build on, and multi-agency working has, I was going to say generally, but I think almost universally has been really strong. And the point I keep making, and I will finish on this point, normality seems quite a long way off yet. We don't think it's going to be a short and smooth return. We will have local outbreaks. I've got no doubt about that. What we don't know is the extent of those outbreaks. I think we're much better positioned now than we were 3 or 4 months ago to be able to manage those. We've got a lot more experience with the virus, but we are still learning. But that virus will be with us for a long term yet, and therefore I think we are going to need to continue to adapt and respond as we learn more about it. But generally it feels that we are in we're moving into a period where it's certainly more stable. The services that we have, we know what we are doing, and again, I'd just like to pay an enormous testimony and thanks to the very, very many staff that have worked so hard in order to get us to this position. And I will stop talking at that point.
Thank you, Adrian. Our thanks goes to you and all the and your team for all the sterling work that you're doing. Right, I have a few members wishing to ask questions. Can we first go to Councillor Jay Ranjan, please?
Thank you, Chair. Schools are opening in September, which is good news. But many parents are concerned about the safety of their children because of COVID. What is being done to reassure parents about this? Thank you.
I think I'll go straight to Colin for that question.
Thank you. I'm Colin Short. I'm the Director of Education in Redbridge. So what we've done is initially when we started to open up the schools, every school did a very detailed risk assessment based on comprehensive advice and guidance that we gave them, which took account of advice from DFE, advice on public health, information that we got through from things like the unions and so on and so forth. Now that the schools are opening up in September, we have expanded that guidance. Our suggestion to the schools has been that actually they don't start with a new risk assessment from scratch, but they do a kind of update, if you like, on the one that they've already got. And we've encouraged the schools to share those with parents because we think it's quite important that parents get to see those detailed risk assessments. The bit that we've done at the moment is we've asked the schools to make sure that they caveat those risk assessments for now with the fact that actually it's possible that that will change over the summer. It's possible that guidance will change, that requirements will change. So we've done that. I think that what I'd say would be the overall view we've got at the moment is that the schools' arrangements so far have worked really quite well. Actually, the schools have been able to balance, I think, making provision for children with the requirements to keep them safe. But clearly, it's going to be a significant challenge for us to move from the numbers that we've got at the moment to all the children being on site. But we are confident that if the detailed risk assessments work the way they have done up to date, then that should be able to give parents the reassurance about what the steps are that schools are taking.
Okay, thank you.
Councillor Jones.
Thank you, Chair. Just picking up on some points that was raised in your presentation about preparing for a possible second wave. I'm just wondering if do we have the latest data available to us to calculate the local R value by what's been reported in the press, like the local lockdown in Leicester was delayed as they didn't have the data available to them quickly enough. And I was just wondering, is that data readily available from other public bodies? And also, can I have a bit more details about the tracking and tracing system? As we all know by what's been reported in the press, we have an app, a tracking and tracing app that doesn't work?
I will pass straight to Gladys, but just to say, I think we need to be careful about the R value, because the R value isn't particularly useful at the moment, but I'm sure Gladys will be able to say much more than me. Gladys.
Thank you. Yeah, I'll start with the R value. When the infection rates were higher, that we were able to calculate the R value, so it meant something. But in Redbridge, the numbers are really low at the moment, so we can't really, R value is only just one tool, so we have to look at lots of other things. So talking about the data, from last week, Public Health England is now publishing data, so you can easily go and access for your borough by ward level. So if you don't have that link, we will send that link over to you so you can have a look yourself. But again, when you see the numbers, don't, because I think Adrian mentioned about the numbers in the presentation. Originally, we were only shared what we call Pillar 1 data. That was all the tests that were done in hospitals and the NHS laboratories. And now we get data from all the other areas, test and trace. So the numbers have gone up, but that doesn't mean that we are into lockdown or anything. But we've been very fortunate in London, unlike Leicester. So we've always had access to data, a lot more than Leicester did. But my role as a Director of Public Health is really every morning, I do get access to a lot more data, really review the data to see whether there's any clusters, whether there's any connections. So we do that collectively, London-wide and also borough-wide. So we do the surveillance quite a bit carefully. So every hour, first thing in the morning, that's my job.
Do you want to mention track and trace?
Oh, sorry. Did you mention about the app? At the moment, we have got testing and tracing, which is the manual method. So how it works is all the tests that are positive are loaded onto a computer, and we would know what the positive results are. And to complement that, we are meant to be having this app, but as you know, the Isle of Wight, it didn't work. So there's meant to be a new system coming, but it's still not ready yet. But I don't think, if you talk to a lot of public health people, they're not really that unduly worried, because the current test and trace system is working very well. So I think Adrian mentioned, we have increased the capacity in Redbridge. So we have got a system now that's working for us.
Councillor Hatfield.
Thank you. Right, what do I want to talk about? Yes. Well, the first thing is listening to your presentation about the testing and the fact it was all done at a drive-in at O2 at Greenwich made me smile, because I had exactly the same problems at work when I tried to get tests through our on-street rough sleeper support. You could only go to Greenwich, you had to drive there, you couldn't get a cab, you couldn't get a public transport, and you could only be driven by someone in your household. And so when I pointed out that half of our staff in these roles didn't have access to cars, they sent me on a completely new pathway, which after about going through 20 people ended back at the O2 at Greenwich with exactly the same problem. So it just made me smile a bit that it was highly chaotic and yeah, very disorganised. The main thing I was going to ask for was about new identified need or unmet need. Because I wondered during this crisis with the wellbeing service, whether some of the people that we thought were highly vulnerable perhaps hadn't needed as much support as we thought they would. But on the other hand, we perhaps identified a lot of new people who hadn't previously been to our attention, actually were quite isolated and vulnerable.
I haven't. I'm sorry. Do you know, I wish I'd eaten it now.
I think
10 minutes.
Sorry, I'm getting a bit of noise from somewhere. I think generally our experience was that, as you've indicated, Councillor, most people actually were able to access the support that they needed with some help from us. So, and we quite deliberately did not want to engage in sort of long-term food deliveries and things such as that, and we were successful in that. I don't think we picked up considerable volumes of unmet need in the conversations that we had, and we had, as I said, we sort of spoke to our service users, people who are shielding, people with blue badges, people over 70, etc. So we cast the net quite widely, but I don't believe we picked up an awful lot of unmet need through that process.
Councillor Gourmet.
Thank you, Chair. My question to Adrian, do we still have the reach out service live? And how many people did we have coming through the reach out service during the lockdown? And do we have a breakdown by gender and LGBT? And I have a second question following that.
Okay. The service is still live, and I think when I talked previously about the learning from lockdown, I think we've learned quite a lot from the service, and I strongly suspect that we are going to maintain it going forward because we've seen considerable benefits from the way in which the service is operating. As I said, we've had 300 referrals. I don't have the data to hand with regard to gender or any other aspects of that cohort, but I can certainly get that for you. We are recording it, so I'll get that and send that through separately.
Thank you. I would be grateful to have that. And well, then I've got some news for you, because I've called twice the reach out service and it's not available. It just says not available. This number is not available. And having extensively put out information on social media about the reach out service, I was contacted by the South Woodford Village Gazette with details of a woman who desperately tried to contact this number to no avail. The newspaper then gave me her number, and I've been trying to make contact with her, but I haven't been able to do so. So I'm extremely concerned that this type of service that is so needed, Adrian, is not available. I suggest you dial the number and see what you get.
Okay,
Can you tell me that?
We'll check that, but the service is receiving referrals as of today, so there seems to be some confusion with that number because some people are getting in. But maybe, Councillor, if you could drop me an email with details of the number that you provided, and we'll get that checked out straight away.
Okay, we'll certainly do that. I have tried to make contact with the woman herself. By the time that I rang her, she was not able to speak to me. She subsequently left a voice message on my phone saying she does need to speak to me, but it's very difficult to get to her, which makes me gives me to think that she is in need. But at least on 2 occasions I've tried the number myself and I haven't been able to get through. Could you please check this out?
No, we will, absolutely.
Thank you. Thank you, Chair.
Councillor Blackman.
Thank you, Chair. Thank you, Adrian, for that really interesting presentation. I just had 2 questions relating to the education aspects. There was a figure you referred to, about 26% attendance, and I was wondering whether that was of vulnerable children or all children that were eligible to attend school at that time. And I just had another question as well, which was in terms of schools returning in September. I just wondered what we think the council's position is likely to be on fining parents for non-attendance, and whether that's likely to be an area that we have discretion over, or we are likely to be instructed by central government as to whether or not we should be levying fines for non-attendance. And I just wanted to add as well, massive thanks to all the officers for all the work during this period. I've had some really positive feedback, particularly on the support from officers on to schools, and particularly some of the support given to schools during school holidays in the form of the holiday clubs that were put on, and it's clear that the head teachers have felt really well supported during this period. So I just wanted to put that on record as well and pass on my thanks.
Good, thank you. I'll pick up the first question and move to Colin for the second. So the 26% was 26% of vulnerable children who were eligible. So it's that cohort. And Colin, do you want to pick up the question around education welfare services?
Sure. So the issue would be government are returning to the statutory position from September in terms of attendance at school. So theoretically, we in the schools have to go through whatever processes we would normally do okay, when a child's not attending school. Equally though, I've had conversations with the heads, and actually I've talked to the DFE about it. We do recognise that even in September, some of the families will be really quite anxious about returning their children to school, and in our view, that's not necessarily quite the same as an absence. So the position that we'll be in is that actually we'll have no discretion over how we record the absence. We'd have to record it as an unauthorised absence. However, subsequently, should we make a decision to, for example, prosecute a family, that is a decision that lies at the discretion of the local authority. So we can take into account context and circumstances. And so effectively, the line that we'll take would be that we'll be as sensitive as possible. We'll take into account individual contexts before we might make any decision to prosecute.
Thank you.
Councillor Noor.
Chair, thank you for this opportunity. First of all, I'd like to thank you for Adrian presentation, and thank you to all the officers that providing the very important service for local community. I have two questions to you. In terms of unfortunate death rate of 310 in Red Beach, I understand in our health scrutiny meeting on 11th of June, the same number was provided. If I am wrong, Xavier, please clarify this matter. And in terms of this death rate, my condolence to all the families, but I want to find out and ask the question to you, do you have any specific data about the number of BME deaths? And if not now, when this number will be available? And also this number should be expecting from the ward-wise as well, because per ward, it will be better for us to have our numbers. Second question to you, in terms of those that are shielding now, I understand that on end of July, the shielding, those that are providing services like food and other services will be, might end. Will you just give in any thought that how you will be providing services, those are shielding, because we understand that we are not going away from this pandemic very shortly, and what's arrangement you have in place? Thank you.
Okay, so if I pick up the shielding question, then I'll refer to Gladys for the data question. So on shielding, as I said, our plan is that we will essentially reduce the level of service with the end of shielding from the 31st of July. In the run-up to that date, we are prioritising calls to people who were receiving food parcels from DEFRA. So there was a national food delivery system. So we want to check that for those households, they are able to source food from other sources, and if they can't do that, we can provide them with some help. For example, we have arrangements for priority delivery slots, etc., etc., etc. So, you know, we want to work with those families to ensure that they can access, as I said, food and supplies. In the longer term, you know, if there is a second outbreak, we might well need to step that service back up again and move back into making proactive calls. But certainly, on the current trajectory, our plan would be to move it to a reactive basis, so people can phone in should they need support and advice, and there will be people on the end of the phone to provide that support and advice, but we won't be making the proactive calls that we have been previously. So Gladys, do you want to pick up the question around the data?
Yeah, thank you. Thanks, Councillor Noor. I mentioned at the scrutiny as well. So we have got some data that Public Health England did retrospectively, but as I said, death certificates do not have ethnicity recorded. So what we are doing is we can use the data to look at Red Beach, but what we are doing is we're going that one step ahead. So we are going to be looking at hospital data, because last time when the medical director of BHR was there and with BARTS, so we're going to be doing an audit of North East London to really delve into the data. So we will have a lot more information a bit later. At the moment, we don't have that really detailed data.
All right, just one more question to you, Chair, if we allow me, just related to this number. Can you just clarify, if this number is accurate up to what date? 310, the death rate, that number?
I think it was about 2 weeks ago. We haven't had any deaths this week, but I'll check and I'll get back to you.
All right, thank you. Thank you. Thank you, Chair.
Councillor Udin.
Hello. Thank you, Chair, for the opportunity. And
And also, Adrian, it's a lovely presentation, and thank you very much for you and your colleagues putting this forward together. What I wanted to ask you, staying on to the BME inequality report that government had published, I just wanted to further extrapolate in here. You mentioned earlier about the disproportionate BME report in our locality as well. I think Councillor Noor had mentioned the data, so I'll just wait for the data as well. But you said the work program. So my first question would be, what is the work program that in place at the moment in order to deal with the BME disproportionate death? And my further question is that very much specific to the what we have seen into the government report, Public Health England, is about the social inequalities. It's about the employment inequalities. It's about the housing inequalities. My first question with this regard is that, do we have the data, local data, available at the moment in relation to those inequalities? And if we haven't, are we in a process to collect those data? And if we have, then what kind of action can we take in order to, moving forward, in order to balance those inequalities, A, and B, is that tackle with further outbreak from the COVID-19?
I'm very reluctant to cut across. I think Councillor Santos will be covering a lot of this material in the presentation he'll be giving after this one with regard to the action plan that we're developing specifically for BAME communities. So I won't get too drawn into the detail of that, if that's okay, because I think we will be covering it subsequently. On the wider issue of data, we do have a lot of data with regard to outcomes for different communities in Redbridge, and generally we've got most of the key indicators around education, around economy, around well-being, which we're able to analyse on the basis of ethnicity, well, a whole range of sources. So, and Gladys and the public health team are very well rehearsed in the analysis of that data, because we have to do that in order to decide on what are the most effective public health interventions that we can deploy. I suppose, Gladys, do you want to give us an example of how we use that data? That'd be helpful.
Okay, so I think again, sort of, we're at the moment looking at an inequality strategy, because as Councillor, you quite rightly said, it's not just about the health outcomes, it's all the wider determinants. So at the moment, because we don't actually have a holistic inequality strategy, so that's what we're going to be working on long term. So at short term, we are looking at how to sort of prevent people, really, because we are expecting a second wave. We just want to be ready. And then the second part is then how do we then look at all the long-term interventions to prevent as well. So that will include all the wider determinants. So we'll be working across other council departments and also our local partners and businesses.
Right, thank you.
Councillor Ahmed.
Thank you, Chair. Adrian, I wanted to ask about care leavers. My first question is, have we got any care leavers at the moment who turned 18 and who are supposed to get accommodation on their own? How are we supporting them, if there is any? And if there is not, will there be some in the near future? And what are the provisions in place to support them?
Okay, I'll turn this straight over to Caroline, who I know is on the call. But generally, we've been seeking to obviously minimise the number of placement moves that children have had to undergo, and that includes care leavers within that. But I'm sure Caroline can say more.
Yes, indeed, I can. So, hello, it's Caroline Cutts. I'm the Operational Director for Children and Families.
Hi, Caroline.
Hello. So Adrian's right. We have been supporting our care leavers and took a conscious decision to not move people at this moment in time. So we were maintaining the placements that those young people had until the point that it has become safe to move them on. We have been keeping in contact with them, so virtual contact, but also some face-to-face contact, meeting them out in the park to discuss with them any issues that they have. The PAs and some social workers were going out delivering food parcels, particularly at the very beginning of lockdown, and generally trying to reassure the young people, our looked after children and our care leavers, that we were there to support them. That has worked really well, and actually they've liked us contacting them virtually rather than the phone calls and the face-to-face meetings. They quite like just doing the FaceTime and Zoom and whatever else we can do. And also myself, Adrian, and Councillor Norman have been having regular sessions with our Children in Care Council and care leavers, our Don't Whisper group, through Zoom. So we've touched base with them on at least about 3 occasions now to discuss any issues that they've got, any concerns that they have, and working out with them the best way to support them throughout of all of this.
Councillor Hare.
Thank you, Chair. Thank you, Adrian, for the presentation. That was very informative. Thank you. I've just got a couple of questions regarding education. Firstly, I wanted to know, I presume there will be plans in place if there is going to be a second wave or a resurgence of COVID or possible local lockdown. So I'd just like to find out a little bit about that. I read a previous briefing note for education scrutiny panel members, and it talked about the extra educational psychological support that we put in place for pupils when they return in September. Obviously, a lot of pupils haven't, unfortunately, returned to school. I just wanted to find out how that will work in practice. Will there be more staff? Will they be more involved in the school? So I just wanted to find out a bit about that. And finally, do we know how, in terms of the government withdrawing the funding to TfL about the for free travel for children under 16, do we know what percentage or what number of children or families that will affect in the borough? I'm obviously concerned because I know of residents who live in the other parts of the borough but travel to where I represent in Hainault and get a couple of buses, so they will be very much affected by this. So yes, I'd just like to hear answers to those questions. Thank you.
I was going to try and answer the transport one, but I'm up to Colin because I know we have had a look at the figures, and for those children that have essentially, generally home to school transport works on the basis that the local authority will supply the transport if the child had no other option than to travel 2 or 3 miles to school. Now, most of the children in Redbridge are travelling longer distances because of choice. They haven't gone to their nearest school. So the numbers that we are statutory obliged to help are very low. The numbers that are travelling more than 2 or 3 miles are high. Colin, can you remember the percentage? You're on mute, Colin.
Sorry, I can't remember the exact percentage, but give me 2 seconds. I have got it elsewhere on my machine, so I will tell you what the actual number is. I'll just be 2 secs.
Okay, well, while Colin's doing that, I'll pick up the EPS and the mental health point. We had been providing psychological support to children and families through the pandemic. The psychology service quite rapidly provided sort of a helpline facility. I think one of the few advantages situation we're in is actually we know that demand is likely to be high. So therefore we've started some work to actually plan for this across children's social care, the psychology service and the CAMS service in health. So essentially what resources do we have collectively to be able to respond to the need that we expect to see in September? And we've also got a little bit of time in order to have that conversation with schools around equipping schools. Schools fortunately have already done quite a lot of training around supporting younger people with lower level mental health needs. So I can't articulate numbers, but I think what we will be doing is probably doing shifting some of our priorities to ensure that actually those staff are more readily available and have time to respond to referrals and respond to requests from help, rather than doing what they might have normally been doing. Now that will create a bit of a backlog, but I think, you know, obviously the earlier we can respond to that need, the better. So that's generally the approach we're going to be taking. And actually, as a borough, we're quite fortunate in having a fully staffed EP service at the moment. So, you know, that leaves us in a relatively good position to provide that support to schools. Colin, you're looking as if you've got a number.
Yeah, so the number at the moment is 475 in total is our overall estimate of numbers that would be affected. 149 of those are children in mainstream schools, and 308 of those are children who've got special educational needs, but who currently use public transport to effectively make that journey, so there's no cost to us. So if we were then to factor that through into what the potential implication for the council is, there would be at least those 308 because they're entitled to transport, but they currently access it obviously through the TfL offer, so they could theoretically come to us. The only other thing that possibly might add to that is that within those 149 in mainstream, it's possible that a very small number of those may have been placed in schools outside of the statutory distances by us rather than by parental choice, at which point their families could make an application to us for transport. But we think the numbers on that will be, we actually think they'll be in single figures actually, the numbers affected by that. So the main impact for us will be those 308 pupils who've got special educational needs at the moment.
Thank you. Just with the chair, could I just follow up? So just to confirm on that last point, would we then have to potentially fund those 308 special needs children because there's an obligation there?
Potentially, yes, because effectively they've got a statutory right to apply for transport. But remember that not every student who applies for SEN transport actually qualifies, and there are other factors that we take into account, such as distance from the home and whatever. But actually, potentially, it would be 308 applicants. More difficult to say of those how many of those would actually qualify for SEN transport, because effectively, because they can use the TfL offer, we never actually have to test whether or not they meet the SEN criteria because they're able to access the TfL transport anyway.
Thank you, Colin. Thank you, Adrian. Thanks, Chair.
Councillor Sachs.
Yes, following on from that, could I just ask Colin how many of those pupils might be vulnerable, if you have any idea about that, and may actually need to have special transport provided rather than be expected to go on TfL transport. But the other question that I wanted to ask, there have been reports in the press about some schools not permitting pupils to do more than 5 GCSEs because the catch-up's difficult. And I certainly hope that doesn't apply to affect the life chances of pupils in Redbridge, particularly where capable pupils are perfectly well able to shoulder 8 to 10 GCSEs, in normal times. And I hope at least our community schools, and one that we have some influence over, will be able to ensure, extra teaching if necessary, so that our pupils won't be disadvantaged. Thanks.
So two things, I think. In terms of the SENs that are vulnerable, we actually think the vast majority of the more vulnerable students will already be accessing home to school transport through us actually, and in all likelihood aren't actually using public transport. But nevertheless, there may be some of them who would qualify for that. It depends also, I guess, in how we look at vulnerable. So for example, we might find that there are some vulnerable students, for example, within that mainstream cohort that are currently using public transport. But in the main, we think the more vulnerable in terms of need profile are already accessing homeschool transport through us anyway. So we don't think that should be too problematic. In terms of the artificial limit on GCSEs at 5, we've been talking to the schools about that. We're not aware of any of our schools that are planning to limit to 5 at the moment, so we are not aware of anybody doing it. We have had conversations with schools, not so much about limitation on GCSE, but on how the recovery arrangements will work. I know that there's been quite a large focus from central government on what they call catch-up. We actually think that that's slightly mistaken, actually, and misses a large part of the point about children, because it kind of gives the impression, I think, that young people are empty vessels, and what we do is we fill them full of information, and so we have to make up for lost time. Actually, we think the bigger issue for students is going to be just coming to terms with the whole return back to learning and getting back into the world of study, relationships with teachers or whatever. So we're planning to focus on that. There have been some modifications made to GCSE arrangements for next year, but in our view, they don't go far enough actually to take account of the potential impact on students. So we'll be lobbying government on that, because we think that actually they should be taking more account of teacher assessment into next year's GCSEs, and that in turn I think would effectively remove that concern for schools that would limit GCSEs anyway.
Councillor Noor.
For giving me the opportunity. I have a question to Colin. Colin, I understand that we have some discussion and also email correspondence regarding the requirement of relationship and sex education. And I just look into this government website, and that is updated on 9th of July. The government still is expecting to be start this teaching from this September. And my understanding that you just mentioned, it will not be happening in Redbridge. Is still the case in Redbridge, or it might change?
So the understanding, my view at the moment is that actually we won't be making any changes in September in Redbridge. In fact, we won't be making any changes in Redbridge until the summer of 2021. Government have decided to remove the statutory requirement to deliver it from September, because a number of local authorities, including Redbridge, are in the position where we couldn't do proper consultation on the planned changes. And so government have given us the opportunity to extend the deadline before the statutory requirements come into April 2021. And we're going to take account of that in full. So we'll use that to finish the work that we need to do with the schools, and then do proper consultation in due course when we can with families and communities.
Thank you, thank you. Thank you, Colin.
I have one or two final questions, if I may. I had a very interesting and very informative meeting and a visit at one of the secondary schools in Redbridge, and I concur with what Councillor Blackman was saying. There is a lot of positive work being done by schools, and the feedback we're getting from parents. My question relates to, if there is a second wave, one of the areas of concern that was raised was the Wi-Fi in schools, particularly secondary schools. Now, if we're going to bridge the gap where young people have been out of school environment, and in order to homeschool, added to which, have we got enough laptops to give to young people that might need them? I'll stop there. So if you wouldn't mind, because I think one of the things that they were saying was that they've had to dig deep in their reserves to get Wi-Fi that would accommodate the number of young people that they envisage needing it to cope with the Wi-Fi and being able to sort of have an effective use of these lessons. But some schools don't have those reserves, and how are you going to manage those?
So I think there are a few different things there. I think that we're clear that the biggest issue I think we've got in terms of Wi-Fi provision, in terms of what I'll call that divide, isn't actually the infrastructure in the schools as such, but actually what individual families have got at home. So in a number of cases, we've got families who haven't got Wi-Fi, or if they do have Wi-Fi, it's low-level broadband and it's not particularly effective in terms of some of the things that they need to do. I think the second thing that we've picked up is that when government offered laptops to children who had a social worker and to children who were disadvantaged, as they called it, in year 10, when we did the review of the disadvantaged year 10 numbers in schools, the number of disadvantaged year 10s that were identified by our schools was about 3 times the allocation that we were given by government for year 10 students. That, I think, gave us an indication that we've still got a real issue in terms of the quality of the equipment. The other thing I think that we've picked up is that when government decided to make that offer, they also offered students who didn't have Wi-Fi at home 4G routers. Those were provided, but again, numbers were too small. But more importantly, the bandwidth size of those 4G routers was far too low initially, and we've had to lobby central government to get that increased to a level where it will be of use to them. I think going forward, I think what we're clear about is that actually, as a local authority, we've got to develop a strategy about bridging that gap. Actually, I think one of the things that's come out of COVID is a clarity for us that actually we've got a real issue about the digital divide. In a lot of cases, the schools have got that infrastructure in place already, use it for homework. Now that tells us that if we've got students who have difficulty accessing it, you've immediately got this disparity in the system between who can access it properly and not. So we're putting together some proposals for that. We've been looking at how some potential providers of the kit itself, that we might be able to source at reduced cost to families and to schools. And we've also been looking at what would be needed in terms of the infrastructure to support all of this. And because effectively, if we give lots of laptops to families and we tell them that we're going to make provision of their Wi-Fi, there's going to be an expectation from these families that we are going to help them with the problems that they might have with that. So that's going to take resource. So my people are currently putting together a proposal on that at the moment. When that's done and we've costed it up, our intention is to go to the schools to look at the schools' accumulated balances and suggest that actually that's something that we might want to invest in as a collection of schools and local authority at the moment. We'll clearly look at the option to apply for additional grants wherever we can to supplement that. But realistically, this is going to be an example where we're going to have to ask schools to dig into their reserves. Now, you are right in saying that some of our schools' reserves are low, but some of our schools have got high reserves. And it's about how we all operate collectively for the greater good is the approach that we're going to take.
Thank you, Colin. Councillor Hatfield, did you want to come in again? You've got your hand up.
Yes, if I can. I do think the access to Wi-Fi and to computers is a valid one. And sometimes it's not just not having Wi-Fi, it's also you might have one laptop in your household between 3 children and a parent who is trying to work at home, which in itself causes difficulties. What I was actually going to ask, with the vulnerable children, following on from Joe's question earlier at 26%, what were we actually doing as a council to, one, make sure those families knew that they were in the vulnerable category, two, to try and encourage them into our schools? Because certainly one of the residents in my ward who was in a temporary accommodation hostel with kids wasn't told when the guidance was changed that TA residents in hostels were now in the vulnerable group. So I just wanted to know what we'd actually done to make sure that these vulnerable families were aware that they had a school place.
I'll pick up this, and then Caroline and Colin might want to come in. But generally, the definition of vulnerable has been generally children with a social worker starting off. So actually, there's been quite a lot of work with social workers and the Education Welfare Service, who are clearly not doing what they would normally do, to be contacting families to encourage them to send those children to school. We also had deployed with us an inspector from Ofsted, who was also not doing what she would normally be doing, and she was put into this space in order to provide support to us and help us with our efforts, particularly with regard to contacting schools. So a lot of contact directly to families to seek to encourage them to send children to schools. But also, I suppose what we did see, and understandably, a lot of concern on the part of those families with regard to safety, etc., etc. But I'm not sure if Colin or Caroline want to add anything to that.
On the education side of it, what I'd add in would be when it came to children in hostel B&B accommodation, One of the issues that we felt was problematic was that it was often difficult for them to maintain social distancing within those environments, actually. And so we had two issues, I think. One was, the challenge for them in terms of their home environment. The second one was from a transport perspective, trying to bring them back into Redbridge, depending on where they were. So in the end, what we decided with the children in the hostels is that actually we would take education to them. So we provided all of the children who were in B&B hostels with laptops. We preloaded them with resources that the school supplied us, so that actually they weren't dependent on things like internet access, because in some of the places they were in, they didn't have it. And then what we did was we effectively had a mechanism whereby we obviously made food and provision orders to the families who were in the hostels. But what we added into it was educational resources that went out to them every week. We also did the same for the under fives. We sent out stuff. So we sent out toys from the children's centres. We sent out ideas about games and things like that they could do in their place of residence at that point in time. So that was how we did that, actually. It was a deliberate decision not to bring them in because we felt it was actually safer.
And
Thank
if
you.
I could just...
That's a good answer.
Councillor Udin.
Yes, so building on the chair's question earlier about the schools funding and particularly in relation to computer and Wi-Fi. So this catch-up funding that the government has announced, and then my question is in Redbridge, is it per schools how much we will get and when and how this money will be used, and would that be money be able to use for facilitating those computers for young people at home, or facilitating boosting up the Wi-Fi? Because we know a lot of young people, families are not actually have enough financial ability to, get as much as they need. So will that be an option for the schools to support the parents, or how this money will be used?
I believe it's mainly focused on content rather than infrastructure. But Colin,
I think that's a fair comment. I think one of the issues that we often get with government announcements is that the announcements tend to come quite a long time before the detail. The detail tends to take quite a bit of time before that materialises. So at the moment, we don't know exactly how much and in what way that will come in. But Adrian is right. The catch-up programme is largely focused on the content that they will provide for students rather than the infrastructure by which the students will access it. So we think that's going to give us limited options around the IT issue. I think what we've learned from the experience of providing the laptops to the children with the social workers and the year 10s is that the laptops we felt that were provided by the DFE, they're better than no laptop at all, but the relative quality of them was pretty poor, we felt. And actually that's likely to lead in the short to medium term to as many problems on an ongoing basis as we're trying to solve. So I think we've learned that if we're going to provide it, we've really got to provide something with a reasonable spec, because some of the stuff that schools do is quite sophisticated if children access it remotely. The second thing that we're clear about is that actually it's not so much about providing Wi-Fi to families, because that's very difficult for us to manage and control. But we do think that the provision of 4G routers is the solution to those who don't have any internet access, because we can have much more of a control and I feel like we can put parameters into that. The third thing I think that we've learned is that actually the key thing I think for us is to get the laptops into the schools, then preload it with some of the software and applications that the schools know that students will need, so that those are on it first, so that it stops the students, I guess, if you like, and or families downloading software and application that we don't really need from a school perspective. And then, of course, whatever limited memory we're able to provide is taken up by whatever somebody happens to have downloaded. So those, I think, are the three core things going forward. But we're clear that we need a clear strategy, I think, about bridging the digital divide, because I think COVID, as I say, has brought it in sharp contrast for us.
Thank you. Thank you.
Councillor Blackman.
Thank you, Chair. Yeah, it was really interesting to hear about the particular efforts made to reach vulnerable children, and that really sounds like some really good work was underway. Obviously, there's you know, there's a lot of children that are maybe weren't previously considered vulnerable, but maybe became vulnerable through the crisis and through the isolation at home and lack of support mechanisms that they might have had beforehand. And from what the anecdotal stuff that I've heard, seems like there was a lot of inconsistency between schools and even between classes within schools in terms of how much contact was made to individual children. You know, I've heard about some schools getting weekly calls, others not getting any calls at all. And I was just wondering whether the council gave any guidance or has any views on how regular that contact should have been, and also kind of whether there's any lessons learnt or thinking in terms of if there's another lockdown, the level of contact which is kind of seen as optimal, or how far the council officers might get involved in giving a bit more direction to schools on that.
I think that what we learned at the beginning, Councillor Blackman, is that schools were in quite different places. I think you're right. Sometimes it was infrastructure, sometimes it was just simply the way in which they'd organised their access to remote learning, and was clear at the beginning. It took us a bit of time to gather that information because, of course, initially the focus wasn't so much on what they were doing for remote learning, but actually trying to work out more, actually, for us, the arrangements for the vulnerable and key worker children who were coming onto site. So that was the priority, I think, for about the first 4 or 5 weeks as we tried to get that up and running. It became apparent to us that actually remote learning provision in schools was hugely variable, both in terms of quality, quantity, the way in which it was organised. We've started the process now of gathering together what we think is the best practice, and we've been promoting that best practice throughout. But I think it links back to one of the previous questions, which is one of the things that we've got to be clear about, I think, going forward, is that some of the schools, but more at the primary sector than the secondary sector, need investment in their infrastructure in order to effectively make remote learning provision. So, for example, some of the schools have got really effective arrangements. We're able to deliver live online tutorials for students through video conferencing. And some of the primary schools were at the forefront of that. Other primary schools had none of that technology in place, and therefore we've got quite a bit of catch up to do with them to get them to a level where they're able to exploit and maximise the potential in some of the things that other schools have done. So that's what we're currently working on. We've been clear with the schools going forward into the next academic year that remote learning will continue to be a professional development focus for us into the next year. So effectively, whether or not there is or isn't a second wave, actually, we think remote learning is something that we've really got to work with the schools on, simply because we think it's going to become a core integral part of education provision going forward into the future.
And just on my specific question about not just remote learning, but actually just the traditional way of making a phone call and reaching out to individual families that way, was there any, have you got any reflections on that?
So there was a challenge in that. The challenge in that was effectively that we were clear that when you were doing that, you were either going to do it through video call or through phone call. Okay, some of the schools had really good infrastructure in place where all the staff had their school phone. Okay, some of the schools didn't have that infrastructure in place, didn't have the clarity about how, for example, teachers could make remote access calls into students by hiding their numbers. So a lot of that stuff wasn't in place at the beginning. In addition to that, I think one of the things that we were affected by at the beginning of COVID quite markedly was that where staff were affected by COVID, particularly those who what we subsequently called clinically or extremely clinically vulnerable, that the numbers of that were not hugely high across the borough as a whole, but it didn't fall evenly across schools. So 1 or 2 schools would have had 1 or 2 staff out of, say, 20 who were shielding and were not able to engage. Other schools at the beginning had 15, 16 staff in that category, which meant they were very limited. And it took us a bit of time to get the schools into a place where people who were shielding, as we called it, and working at home could still do work remotely. So that took a bit of an issue. But I think the schools are better placed now because I think they've got the arrangements in place in terms of how staff would do that for a second wave. I also think that actually now that the thing has gone on for 4 months, I think everybody's clear about the importance of keeping in touch. I think everything's developed. So, you know, the way in which schools use, say, video conferencing and telephone calls with students has improved markedly. I think the only other issue that we took a bit of time in checking was about the safeguarding requirements, because it is difficult for individual teachers if you're on individual calls with children over, particularly on sort of mobile phone lines, because you know the risk of actually you've got to be clear about somebody's got to know what you're doing. So it took a bit of time for some schools to put those processes in place, but we think all the schools have now got those procedures in place and have got the kit to go along with it.
Councillor Noor.
Thank you very much. I don't have any further question in this episode for the next presentation. There's one question in terms of the laptop and IT, as we're just asking lots of questions to Colin. One thing is not clarified yet. How many laptops is so far distributed to the social workers' children and those are in need? Because we need to find out that is there anything number in your head? I understand that you're just trying to struggle out the number.
I'll give you a rough number. I think the number on the social worker laptops was somewhere around 640. Yeah, 640. Right. Caroline's nodding at me, so I've got that one right. And I think the year 10 disadvantaged laptops was about 280.
All right. Okay. Thank you.
Okay.
Would the cabinet members or other members present wish to add anything?
Chair, sorry.
Thank you, Chair. I'd just like to put on record my thanks, not only to Colin, but to our head teachers and staff in our schools who have done an incredible job over this time and will continue to do it as they look to cope with the sort of mandatory return of pupils in September. And I am confident that Colin's department will offer, appropriate guidance, support and challenge, and we should be in a position where children should return in as safe an environment as we can possibly and the schools can manage. So that's really all I'd like to add, Chair.
Councillor Cortiara?
Yes, Gilly.
It's Cal. Sorry, I've had an email from Councillor Mohammed Javid seeking your permission to ask a question.
Yes, of course.
Councillor Javid, are you still in the meeting?
Cal, I've just invited him to join, so he should be able to participate now.
Okay. Thank you.
Chair, he hasn't joined yet, so you may want to move on and I'll alert you when he's joined.
Okay. Shall we move on to the next? Oh, can I ask, were there any recommendations, Adrian?
No, at this stage, I think the presentation was essentially to bring the committee up to speed with what we've done and where we were going, and to provide you an opportunity to comment on that. But there were no specific recommendations arising from the presentation.
Thank you so much. Sorry, Lynn, did you want to say something?
Yes, I did want to add, I didn't mean to leave out the social care and the fantastic work they've done well during the pandemic. So I could just like to put it on record.
Yes, Gilly.
Chair, just to note that I've got a few actions that I've noted, for example, about the public health data, and also some other actions as well that Adrian had agreed to undertake to provide for the committee. So I'll include those in the minutes if that's okay.
Thank you. Councillor Blackman.
Thank you, Chair. Yeah, I just wondered if we could also make formal note of the thanks to officers for all their hard work and head teachers as well, and maybe even communicate that as well via Adrian or Colin as well from the committee.
I think that's absolutely right. Thank you very much, Joe, for suggesting it. Adrian, thank you, thank your team, and thank all the heads and their teams for the wonderful work that they're doing.
we will pass that on. Thank you.
Can we move on?
You need to unmute your microphone, Councillor Taylor.
Sorry. Agenda item 6. I now invite the Cabinet Member for Health and Social Care, Mental Health and the Ageing, Councillor Santos, to present the item.
Thank you very much for the opportunity to present this item. I'm just going to share my screen. Is that visible to everyone?
Yes. Yes.
It is.
Thank you so much. Just to say, just to start off by saying, I wanted to just add my thanks to the team in adults and public health, and actually officers across the whole of the council, and our partners in health and the voluntary sector, who have done an amazing job in supporting our community over this time. I also wanted to give thanks to the leader of the council, Jazz Athwell, and also Councillor Judith Garfield for the work they've done in securing a permanent testing site for COVID, which is opening this week. And a particular thanks also to Gladys and to Ian Dilley, one of our public health consultants, who has made that, been important in making that happen. I just wanted to talk through this presentation, which is very much about the council's immediate response, our first response to the growing evidence and the growing issue around the inequalities that COVID-19 is presenting to us. It is very much a focus on communities, a response to communities. There is lots of other work, as you've heard today, great work that's happening with Colin and his team and Caroline around children and education. I know there's great work that public health have been doing and others in relation to care homes, but this is very much focused on communities. And what is quite evident, and actually as the pandemic progressed, was that COVID is not a great leveller, and it was very clear that some communities, and in particular some Black and South Asian communities, were disproportionately impacted by COVID, which resulted in Public Health England being asked by the Chief Medical Officer to undertake 2 reviews. One was a quantitative analysis of the existing data, and the second was a qualitative analysis and a literature review, plus some conversations and dialogue with Black, Asian, and multi-ethnic groups. I think in the second report, Professor Kevin Fenton, the main author, spoke with 4,000 people in 17 sessions, I think is the number of that. And as I said, this presentation sets out the immediate response of the council and a response to that growing evidence about that particular concern. And I think it's really important. I think Councillor Jamaluddin talked about the wider determinants of health and the impacts there. Our immediate response can start to touch on some of those, but actually there's got to be a council-wide and actually a wider than that response to help try and address some of these inequalities that have always been with us, but actually that COVID has exacerbated through and surfaced. What do those 2 reports show? And those reports show that people from some Black and South Asian communities have a disproportionate risk of serious illness and death. And if you look at the reports, they will illustrate to you that, for example, accounting for age, sex, deprivation and region, people from Bangladeshi communities or Bangladeshi ethnicities have 2 times the risk of death than white communities, and that people from Chinese, Indian, Pakistani and other Black and ethnic populations have a 10 to 50% higher risk of serious illness and death than white British communities. And there are other factors that are associated with increased risk of serious illness and also sadly death, and those factors include comorbidities, so issues for example, like diabetes, CVD, cardiovascular disease, hypertension, amongst others. But other factors such as age, gender, occupation, deprivation, and geography were also ones that are independently associated. And as with the comorbidities, comorbidities in particular, gender, occupation, people from Black and South Asian, some South Asian communities are overly represented. It's a point of intersection with those communities. As I said, it exposed and exacerbated long-standing inequalities, driven by those wider determinants that we've just touched on, from occupation to housing, amongst others. And it also surfaced inequalities driven by individual and institutional racism, which is, and the report also showed that the results of this historic situation have been such that they cause a distrust with communities. And one other issue or concern is that people therefore present late or have concerns about presenting. And this is important to redress as we're going forward in terms of a conversation about track, trace and isolate, promoting flu vaccines, also when and hopefully when and soon that the COVID vaccine comes out, promoting the uptake of those vaccines. Addressing inequalities isn't something we do one-off, and isn't something for just around this time. It's actually got to be a sustained response, and it's got to be a focus of everything we do and everything that we think about doing in the council. And as I said, there is what those reports showed was that there was a growing need for an immediate community-focused response. So what will we try to achieve from a community response? Well, what key things would be around, and it's quite obvious, but I think needs to be stated: preventing or mitigating as far as possible coronavirus acquisition, equipping communities with the ability to more safely navigate COVID-19 risk. I think also understanding the needs, the concerns and needs of the community. There's lots of confusion, there's lots of myths, the guidance can be quite confusing, and actually I think sometimes people find that difficult or challenging to see how they would apply that in their lives. People might also think it's all over, just to the way that the lockdown has been eased. And a point I keep making is that to ensure that this immediate work in addressing inequalities is the first step. And actually, working with the public health team under another public health consultant, Louise Gisnall, have set out developing a strategy where this is literally the part of the front end of that strategy. So, what are the key messages that we're going to be taking out, or hopefully taking out to people? As I've said, it's how people can mitigate the risk of acquiring COVID, helping people think about and understand the guidance and apply it to their lives. How can people within who living perhaps in an intergenerational household, what can they do? How can people who perhaps don't have agency in the workplace or are on 0 hours contracts, what can they do? Helping people think about some of the messages that we need to support such individuals, whether it's about perhaps encouraging people to join unions, whether it's about making sure people are aware of PPE requirements and perhaps what they should be asking for and that they're entitled to ask for it. Supporting the communities to understand about the health-related risk factors, and not in a blaming sort of way, but just to ensure that people are aware of and in fact can best seek out how to manage some of those health situations, ensure that perhaps their diabetes is under control, ensure that they're addressing their hypertension if they have it, if people are smokers, perhaps encouraging them to stop smoking, but doing that in a way that certainly isn't blaming or shaming. And as I've touched on before, I think some of the structural issues that I highlighted, we might not be able to, in this stage, in this response, make significant change, but we can help people to explore options and ways of minimising harm. And I think one of the other key issues that we need to be doing is promoting the understanding of test, trace and isolate, promoting and building relationships of trust with communities around issues about the uptake of the flu vaccine, supporting people around issues of trust around going in and getting taking up their appointments around things like cancer, and also, as I said before, when the COVID vaccine eventually comes, to encourage people to take that up too. So these are some of the direct things we'll be sharing with people, and perhaps it's worth just spending a few minutes to rehearse them. I don't like the phrase social distancing. I like physical distancing because I think it's important that we still remain social. That's good for our health and well-being. But certainly, to people need to maintain the physical distancing guidelines. People wash hands frequently with hand gel or soap. So remember your hand hygiene. Remember to clean and frequently touch surfaces. The guidance is growing around face coverings, certainly on public transport, and I think we'd start to say if you are in shops or enclosed spaces which aren't particularly well ventilated, use face coverings. As we touched on, make sure all your vaccinations are up to date, maintain a healthy lifestyle, and ensure you have all your medicines to manage your long-term conditions that we've touched on, like diabetes, heart disease, or chronic kidney disease. And how will we achieve our aims? I think what's important is that we work with communities to create messages that are relevant to them, that those communities will hear, and actually help us to connect with them. I think it's important that we equip leaders and influencers in our community, whether it's yourselves as councillors, community organisations, relationships of trust, community faith leaders, influencers that can share key messages, help bust myths, and actually also be part of the feedback to share some of the concerns that communities are talking about that perhaps we can help address. I think we also need to do a targeted social media campaign, and that's stuff we're working on at the moment, with marketing collateral that can be used across Facebook, Twitter, and also informal WhatsApp groups that many of us as councillors are actually part of, and will have opportunities to share out information to different communities. And actually involving, and the campaign involving local and community print and broadcast media. We have been doing some of this work already. Gladys has been a radio star on a number of occasions on New Sound and other radio stations. And I've also been, I know that some of you in this group and have contacts with community broadcast and print media, and it's just using those opportunities for us to pass out messages. Holding a number of online events. Redbridge has a BAME communities network, and using opportunities such as that, but actually reaching out to communities and perhaps doing some targeted work with particular communities, seeing if we can join some online events. I know that a lot of faith communities are still having online services, and perhaps we can join those to be able to speak at them and share some of these messages, using existing community events as well as faith community events. And things like the voluntary sector have meetings that we can join and share, and information gets passed out. And what do we need? I think the ultimate success at the start of this, I think the council plays a role in, needs to play a role in catalysing and getting out the messages and encouraging others to help get out those messages. But eventually we want to have a situation where the council is supporting and promoting supporting the community to actually be able to take out messages and answer questions and queries. It'd be great to get your help in shaping messages. It'd be great to get your advice and help in what community concerns are. It'd be great to get your help in delivering messages. And I know Councillor Saira Jamil has already volunteered to do a Urdu video around COVID, and I have been offering up, without telling her, Councillor Saima Ahmed, because I know she has connects with lots of community and print and broadcast media too. And we need your help in busting myths. So wherever we hear that, I want councillors and other community leaders to be able to address that so we can quickly squash things. And also councillors need to know where to get access to information from. We've got a really great coronavirus information hub on our website, which actually does have some of the data which is useful. So you'll know a point to come and get data that is verified. So that's the presentation. That's the sort of work we're doing in terms of the immediate response. And we are happy to answer questions and to get people's input.
Thank you, Mark. That was really, really interesting and very useful. I've got Councillor Khalid at Noor with his hand up.
Yeah. Yes, Chair, thank you. And thank you, Mark, for your wonderful presentations. And it was very useful. And I like this, the last part, you are appealing for help to the community, reaching out. I think this is a right approach from the council perspectives, because we need community support and need to support each other because it is affecting every single communities. In terms of my actual question to you, you highlighted about the inequality and also inequality in individual level or institutional racism as well. And this is, I think, the first step that we're recognizing that something exists, and also this pandemic clearly highlighted that equality exists within our society, and it is exposed seriously by the unfortunate death rates. But in terms of your measures you've taken from the council perspectives, the short term, and I think so it will be helpful to contain if there is a second outbreak, but it will not address the inequality that exists actually. What are the, I understand that probably you will not able to probably answer my question, but what are the thinking we are doing at the moment for the long run to address the issue about the inequality in terms of the employment, in terms of council actual job employment facilities, and also opportunity to go to the hierarchy, and also housing, because this is the things at the core of our inequality. Unless until we're able to address this issue, I don't think so. I'm afraid we're not able to address this issue, the equality that exists affecting every single community, especially BME communities. Thank you.
Thanks very much for your question, Councillor Law, and it's a right one. The reality is that some of the inequalities are structural, and these can't be dealt with immediately. And you're also right that in saying that that COVID has exposed and actually exacerbated existing inequalities. What we're trying to do with this immediate work is preparing our communities in relation to the likely second wave, and if it's not even a second wave, the localized outbreaks which might again disproportionately impact on those on BAME communities, in particular Black and South Asian communities in particular. So that's what this piece of work is, but it sits within a context of a wider piece of work around inequalities that we're doing, that's been led by public health at the moment. But you're right, this is a conversation that's much broader than that, and the council's policies on housing, the council's policies on employment and approach to employment are also ones that on the longer term will hopefully start to address some of these issues. And we can't do it alone, so we need to do it in partnership with, I think the phrase is anchor institutions. Being able to work with the other big employers, such as the health service, the fire service, the police service, working together to address some of these issues. But you're absolutely right. It's not it's not a quick fix around any of this. It's a longer term fix. Is anybody else?
Excuse me, through you, Chair, could we just ask Councillor Santos to please stop sharing his screen?
Yes.
So that it's a bit clearer for everybody else to use the screen. Thank you.
Yes, that's good. One.
Is it gone now?
Yes.
Yes, it has. Thank you.
Councillor Ahmed.
I was wondering why it was blinking.
Thank you, Chair. Thank you, Mark, for the wonderful presentation. Just wanted to point out through your presentation, it's quite clear that there's a genuine gap in terms of communicating with the communities because of language barriers. Now, there is something that I've been actually talking about for a long time, that we have one of the most diverse boroughs in the country, but clearly there is a lack of communication in terms of what we are sending out and how we are connecting with them. And it's related to inequalities itself, because a lot of the communities work that we do or talk to them, they often don't understand the language and the myths that's associated to it. So if we come out like this with what you have suggested, I think it's really, really an effective way to reach out and talk to them. I would definitely volunteer if you'd like towards that piece of work. Also, can I request if we got some form of communication strategy of how we are going to proceed with such information work? Because I know Gladys did mention about the equality strategy that the public health will be looking at, but would there be a communication strategy as well related to it?
So I've already volunteered you several times, Simon. I've used your name vein, so I'm glad that you're happy with that. But I think that that communication strategy is evolving from the plan that we're developing, and actually it is to be multimodal in its approach, because that's the way we're going to hit communities. It's also, as I said, to try and create it with communities in terms of the approach, and it is also to try to be both culturally and linguistically sensitive. And I think we just really want to make sure that we get this right. And I know that both Gladys and Adrian are very much behind the approach that we're taking. We're also looking towards perhaps strengthening our public health team by having an inequalities public health officer. Not that that means that inequalities will just be dealt with by that particular person, but actually there'll be a cross-cutting officer that will support and underpin some of that work and strengthen some of our work and make sure it is the longer term, the address work around, say, long-term conditions and others, to make sure that it is connecting well and connecting as well as we can with communities that are disproportionately affected. I hope that covers it off. But yes, it's in process, Simon.
Councillor Burt-Jones.
Yeah, thank you, Chair. I think some evidence suggests that some individuals with certain underlying health conditions are more at risk from COVID-19, and they happen to be more likely to come from BAME backgrounds. I was wondering if it's worth maybe sending out like a public health message or lobbying for people who are shielding, who are perhaps at medium risk if they come from certain ethnic groups, to put them at higher risk if they have certain underlying health conditions as a kind of a policy platform, or if there's any scope for that, or if it's possible.
That's a really interesting point. Thanks, Bert, and something we'll take away and have a think about. But that sounds a really interesting point.
Councillor Hatfield.
Thank you. Well, on the languages, I was just going to make the general comment that in certain areas of my ward with huge turnover, lots of HMOs, lots of new populations coming and going, although we can send information out through for the established communities, through the mosques, through the gurdwaras, through the churches, wherever, a lot of those most vulnerable people in the HMOs, in the multiple occupations, don't engage with those communities because they're quite transient. And so actually, there is a real piece of work about, for those most marginalised areas of wards, how we get that messages across, because they don't have the established community links. Whereas in other areas, we've got diverse populations, but they're to correspond with them.
I mean, that's a really good point. Thank you, Ross. And I mean, if you have any solutions, or if others have solutions around how we can best address that, we'd be really grateful to hear it, because pretending for one instant that we have all the answers in public health, and certainly that's the reason why we're going out to people to ask for their input.
Thank you very much, everyone. Thank you, Mark. Mark, are there any recommendations?
It's probably to note the report. I actually haven't got the papers in front of me. Sorry, very remiss. It's probably to note the report and actually, yeah.
Okay, thank you very much. I would like to thank all the speakers for their presentations. Thank you so much. It's been very, very informative. Date or agenda item 7, date of next meeting, indicative business and update on any associated groups. Now, the date of the next meeting is scheduled for 1st of October 2020. Regarding indicative business, I would like to suggest that as further discussions are required regarding the future work plan / programme, any topic suggestions are noted today or sent to the scrutiny officer, and the agenda for future meetings are finalised in liaison with myself, the Vice Chair and spokesperson and relevant officers. Are there any comments and can this be agreed? Please raise your hand or indicate in chat. Thank you. Regarding associated groups, the Education Scrutiny Panel will be meeting virtually on the 29th of September. The completed action plan arising from the Scrutiny Task and Finish Group review of the social isolation of older people was due to go to the Cabinet meeting in March and was cancelled due to the pandemic. With Cabinet business restarting, there is a need to progress the action plan, but a number of the actions may need to be reviewed in view of the current situation, and it is proposed that this is progress in 2 stages. Stage 1 for Cabinet consideration in September would involve rewriting the report and reviewing each of the actions with a view to asking officers to set out action which, as far as possible, and reflect intent behind recommendations, but within the restrictions imposed by COVID. This might mean, for example, seeking virtual or telephone interaction rather than physical, recommending a follow-up to pupil scrutiny. Second would be pupil scrutiny to receive an action plan in the future post-COVID. Are there any comments and can this be noted? Please raise your hand or indicate in chat. Thank you. Any other items? As far as I know, there are no items. Motions to exclude the public? There are no exempt items. Thank you all very much for attending. I close the meeting. Thank you so much.
Thank
Good
you.
night.
Thank you. Bye-bye. Bye-bye.
Thank you, everyone.
Thank you.
Chair.
Bye-bye. Bye.
Bye.